The family of one-step resuscitation electrodes are designed to work with the R-series. There are electrodes for every need, including specific electrodes for pediatric patients. The advanced features of one-step resuscitation electrodes include automated self-tests, code-ready connectors, and electrode expiration alerts. The R-series can also work with Zoll specialty electrodes, internal handles with spoons, and external paddles. You can also use standard 3-lead or 5-lead ECG electrodes for monitoring your patient. Multifunction and ECG electrodes must be placed on clean, dry skin. Clip excess hair. One-step electrodes should remain connected to your defibrillator at all times. To connect the electrodes to the one-step cable, slide the end of the cable into the electrode connector. The two largest pieces will connect. They should fit together easily and create a tight connection. To open the one-step electrodes, grasp the electrode packaging at the yellow triangle and firmly pull open, separating the two sides. Notice the one-step cable is attached to the electrodes. Pull the cable up from the package to separate it. To apply the one-step electrodes, place the back electrode first to prevent buckling of the front electrode. Grasp the rectangular red electrode labeled 1 and peel it from the plastic liner by lifting at the red tab at the base of the electrode. You may notice the self-test connector wire attached to the electrode packaging. This connector is used to verify the integrity of the electrodes and confirm their clinical readiness during the code readiness test. The self-test connector only works when the electrode packaging is unopened and attached to the R-series. Roll the patient onto their side and then roll the electrode onto the patient's back to the left of their spine and under the scapula. To apply the front electrode, grasp the triangular blue electrode labeled 2 and peel it from the liner by lifting at the red tab at the base of the electrode. The one-step complete and one-step CPR electrodes include a CPR compression sensor. Place the sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples. Roll the electrode onto the patient's left chest with the blue triangle midway between the sternum and nipple. For female patients, lift up the breast if necessary in order to position the electrode underneath. If anterior-anterior placement of the electrodes is desired, use one-step CPR anterior-anterior electrodes. To apply the one-step CPR anterior-anterior electrodes, grasp the apex lateral electrode at the bottom and peel away from the plastic liner. Apply so that the top of the gel treatment area aligns with the bottom of the pectoral muscle on a male patient. Position the electrode under the breast on a female patient. Peel the electrode from the liner by lifting at the red tab at the base of the electrode. Align the CPR sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples. Roll the electrode onto the patient's left chest with the blue triangle midway between the sternum and nipple. Apply on the patient's upper right torso. Placement of the apex electrode varies slightly in the anterior-anterior configuration. The more lateral placement increases the likelihood that more of the heart musculature will be within the current pathway. One-step CPR anterior-anterior electrodes can be positioned in an anterior-posterior position if needed. For children under 8 years of age and under 55 pounds or 25 kilograms, use one-step pediatric CPR electrodes.